Thank you so much for inviting me to IMCAS Brazil. I really wanted to be to Sao Paulo, but I was unable to due to visa and traveling arrangements. Let's talk about skin rejuvenation and if actually it does happen with fillers or not. I have no conflict of interest, and this is a review of over 239 articles. Fillers get the anti-aging world go round. There are permanent fillers like silicone that's more appropriate for breasts, semi-permanent, semi-permanent, and non-permanent like hyaluronic acid that naturally dissolves. Some interesting filler techniques, the duoplane technique, you restore the fat compartments first and then the most superficial ones. So here is the deeper parts and the most superficial parts is in the picture. Needle size is very important, and that's something we have to keep into consideration. Now, I looked at many studies. This is just one of them, a comparison between autologen and bovine fillers, and it didn't seem to make any difference. Basically, the histology did not produce results that were, when you compare them, they were not statistically significant. So basically, both of them were equally good or bad. Now, there are studies that have shown in biopsies that fillers increase procollagen 1 and also gene expression for types 1 and 3 procollagen. And this is what collagen synthesis of type 1 collagen looks like. Now, there are other studies, however, that sort of question this, and they say, well, maybe it's a result of mechanical stress and not the direct effect of the filler. And there's more studies that I found that basically think that procollagen production is the result of mechanical stress, also hyaluronic results, hyaluronic acid. Now, this is what mechanical stress would look like. Basically, would be an artifact of the injection. Now, the other thing is that hypoxia would increase collagen. So if there is not enough flow of oxygen into the system, there will be an increase of collagen. However, that's due to hypoxia, which is not rejuvenation. It's actually something that would eventually age the skin. On the other hand, there is a lot of authors that treated 2,362 patients over 68 months with 11,460 ml of hyaluronic acid, and everybody had wonderful results. Some patients developed signs of vascular compromise, but they were able to be treated, and those resolved within 2 months. And about 21 patients experienced late onset temporary nodules that were again successfully managed. Now, fillers work great for the young, but however, with the old, not so much. And they also give that pillow effect that you can see here in Nicole Kidman's face. Now, fillers do have contraindications, and we have to be very aware of these contraindications. Viral and bacterial infections near the site of the injection. We have to avoid viral and bacterial infections, acne, parasitic mite infections, and allergies. Sometimes fillers will not be effective when they're very thin skin and with several wrinkles, like the lady on the right, or inflammatory dermatitis. For this type of skin, very thin skin, there is other techniques, and we use these other techniques. We used actually signaling resonance energy transfer of this lady to treat her, and we found very good results in 20 treatments. We can see the difference on her neck, one treatment, 20 minutes. Now, cosmetic fillers can sometimes destroy your looks. So basically, they do have some side effects. This is Marie Adams' left and after. So we have to be very careful and very skillful with our filler injections. Ridging and heading can also be happening, blanching and pain. They can all be corrected with hyaluronidase, with hyaluronidase. And if there is a persistent inflammation, then it can be treated with antibiotics. Nodules and lumps is another filler effect, and tindal effect, just looking blue. arteriovascular occlusion, that's the hypoxia we're talking about. Now, you can use a hyperbaric oxygen therapy, or you can use the other technology that we're not going to be talking about today, but it's signaling resonance energy transfer, and that can kind of take care of different filler problems. Skin necrosis is also a problem. This is some articles that show the effects of fillers. This is some articles that show the effects of fillers. Filler complications can even be blindness due to vascular complication and arterial occlusion. So they can be quite severe. So again, we have to be very careful. Bovine-derived collagen products must be skin tested before the treatment. We have to have an understanding of different recommended depths for the injecting of different products. And ridging or heading, we need to have kind of a way of treating it right away. We have to avoid the area around the eyes. And there is a risk of necrosis, ulceration after injection with a dense filler like Zyplast or autologous fat in between the eyebrows. So we need to understand all that. But the important question we need to answer today is that is collagen production that they may or may not produce, the fillers, is that rejuvenation in itself? And the problem with that is that collagen in itself is not enough. Why? Because type 1 procollagen is not enough for facial rejuvenation. The skin has about 7 types of collagen, and only the epidermis has about 18,000, 127,000 other proteins just in the epidermis. So, and you can see here different studies and how they have basically found this effect that I just said, that's 18,000. And some of these proteins, when collagen is overproduced, then these proteins are non-functional because they are overproduced and they're unfolded. If a protein is unfolded, the cell is brain dead. So if the protein is folded, the proteins are the brains of the cells. So it's not just how much protein or how much collagen the skin has. It's also whether these proteins are communicating optimally with each other and whether there is protein homeostasis. We call that proteostasis. And that's what youthfulness is. Optimal communication between proteins. So increasing collagen is a small aspect of rejuvenation. There is no true rejuvenation without proteostasis. Proteostasis is a dynamic regulation. It's a complicated network of interacting proteins, biogenesis, protein folding, protein trafficking, etc. For true skin rejuvenation, all these factors must be addressed, like the cellular processes, metabolic processes, regulation of biological processes, cellular communication, cellular differentiation, response to stimulus, cellular communications, and interactions in the network, cellular pathways. So there's so many things that have to be interacting in an optimal basis as a homeostasis in order to revive regeneration. The problem with type 1 collagen is that it also is upregulated due to metagenesis. So it's not in itself a very good thing because it's also upregulated in something that is very damaging to our skin and our system. Hypoxia is also a problem. It's low level of oxygens in body tissues. Yeah, that will create collagen, but that's not a good thing because eventually hypoxia will age us. So we don't want that. And this is how an article that shows how hypoxia was induced, how collagen was induced as a result of hypoxia. So skin rejuvenation feels fake or reality. It's real with younger people. It works great. They may increase some procollagen 1. It doesn't look like that's gonna give you rejuvenation. It increases volume. It has instant results. People look beautiful. They can be permanent, semi-permanent, or non-permanent. Minimum downtime. You just do the injection and you're done. And however, with older people, it doesn't quite work as well because it kind of becomes too obvious and then everybody knows you have fillers. But according to research, procollagen increase may be due to hypoxia or mechanical stress. So it's not even involved in the rejuvenation process. And hypoxia and inflammation and mechanical stress are something that will eventually age us faster. So we need to keep that in mind. So the reality is that fillers increase procollagen 1. We have studies that prove that. However, procollagen alone cannot rejuvenate the skin. There are 7 types of collagen involved in skin youth. There is about 18,000 plus different proteins involved only in the outer epidermis. So, and aging is the loss of protein homeostasis, the proteostasis, which is a dynamic regulation of balanced functional proteotome. The proteostasis network includes competing and integrated biological pathways within cells that control biogenesis, protein folding, protein trafficking, and protein degradation. And with this, I would like to thank you for inviting me and allowing me to offer this presentation virtually. Thank you very much. If you need to get in touch with me, please email me at science@iellios.com. I will try to answer all of your questions as soon as I can. Thank you.